Just like every other part of our body, it changes. So we're going to talk about what those changes are and why that might lead you towards a labiaplasty. Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita down in New Jersey. I'm a board certified plastic surgeon and one of your co-hosts. And I've got Dr. Amalfi with me. Hi Ashley, how are you?
Hi, good babe, how are you?
I am good. So I don't know about you, but I'm feeling pretty good about this series that we're doing all about labiaplasty. I feel like this is a topic that nobody wants to talk about, yet everybody wants to know about. So
you guys are gonna all just watch this stuff alone and just be searching for it, and I feel so good to just bring you like real info. Like this is it.
Right. And you can just do it by yourself in the privacy of your own home.
You don't have to ask anybody. You don't have to talk about it. You could just like Google it and find us.
Exactly. Right. And everything we're telling you over this series is exactly what we would be saying to you if you came in for a consultation. So it's real information so that you guys are all educated and empowered. So today we are going to be talking about the changes that we see in our labia through life, right? Just like every other part of our body, it changes. So we're going to talk about what those changes are and why that might lead you towards a labiaplasty in some instances, right?
Yeah, I mean, and I think the first time that we start to actually see those changes is really young. It's puberty when like you know, all that external genitalia starts changing, and we think about it, I guess, probably more in males as they have those genital changes with puberty, but we really don't ever think about it in women. But it's really true that those labia are going to grow with you and they're going to start to develop a little bit more. And so I definitely see younger patients who go through puberty and then recognize that their labia minora do really grow a lot. So I mean, I think really early on you're going to see like that wave of change, right? And then, you know, what would be the change that you see next after that, Smita?
I mean, I would say after puberty, it's again when we have these big hormone changes in our life, right?
Yep.
So with pregnancy, childbirth, you know, just like, you know, I feel like these are all very hormonally sensitive areas of our body, right?
Yeah.
We see the changes outward, like externally, when we, you know, have changes in our breasts, right? Because, you know, that's very visible in clothing, but you don't see them or talk about them so much when it comes to the labia. But I would say it's during pregnancy when we do have these big changes, right?
Yeah. I mean, even if you don't, like some people are like, well, I had a C-section, but it's not necessarily like the birth that's really stretching things out. I mean, it's just that you're carrying a big, you know, a child in your uterus, and all that weight is on your pelvis, and that does cause like some venous stasis, meaning like the blood is pooling there longer and things are getting more stretched out, they're getting more swollen, and that can have lasting effects. So it's not just the birth, which can stretch things out too, but sometimes just the pregnancy itself that stretches out the muscles and the tissues and all of that. So we definitely see another like little wave of it around pregnancy, childbirth. You know, the interesting thing, and this doesn't happen a lot, so if you haven't had kids, don't freak out, but sometimes you can have tears. You know, we think about tears like posteriorly, like going towards the anus, but I have seen a handful of women who have tears of their labia from childbirth or really quick natural childbirth. So that can happen too, where it gets like a little tear, and then oftentimes it's not repaired, so then there's a little notch. And those are, you know, normal and they happen, and I'm sure they're not comfortable, but certainly things that we can fix as well. So that's another change that you can see.
Right. And then I would say probably there's like a third major time in our lives, right?
Yeah.
When we do notice a lot of changes. And I think that's when we're older, right? We're postmenopausal. And again, we sort of have those hormone changes, right? And people can sort of have labia majora that lose that sort of fatty sort of fullness and become deflated. Or, I mean, there's so many changes that can occur after menopause.
Yeah, absolutely.
Or during menopause, right?
I mean, when all those hormones are changing, like some of the tissue quality changes, the elasticity of our skin, I mean, everywhere changes, but you know, the external genitalia does too, and that tissue changes and loses elasticity, so it can hang more or look a little bit like wrinkly and deflated. It can feel drier, and that causes irritation. So many changes happening there. So it's pretty wild, you know, all those different time points. And I guess the really cool thing is that as someone who does a lot of labiaplasty surgery, Dr. Smith and I are seeing patients at those big major life, you know, points. We're seeing young women who have gone through puberty, are in college and aren't comfortable. We're seeing you guys after you have your kids and you're not comfortable. And then we're seeing women as they mature and have changes and they want to correct those changes. So, it's fun for us because we get to take care of all of you, right?
Yeah, exactly. I know. I mean, we have like such a diverse group of patients that we work with which makes our job really fun and rewarding.
Yeah.
But I think also there's another category too. I mean, I think so the puberty, pregnancy, menopause, that's all I think very centered around you know, like the hormonal changes, but even weight changes can cause
weight loss.
You know, weight loss, weight gain, all of that can, just like it affects every other. You know, this is still a part of our body, so it's still going to go through the different changes, and it can get stretched, it can get more full, it can get thinner. I mean, all of these things happen in our labia as well. So especially the majora, I think. The majora and the mons, I think sort of the external area is, I guess, primarily where we would see it. But still concerns that people might have. So it's all normal. And it's all normal changes. So that's like the biggest thing to just be aware of.
Yeah, these are all things we would expect. But if for some reason, you know, you don't like the way it looks or feels, then, you know, check out a board-certified plastic surgeon and we can talk to you about options. But
absolutely.
Lots of changes, all normal. Now you guys kind of know what to expect, what to look forward to or not look forward to as your labia changes with time.
Well, thanks for tuning in, and we've got a lot more coming in this series, so make sure you subscribe, Lipstick and Lipo. We are on Spotify and YouTube, so come find us, and we will see you guys soon.
See you there. Bye, guys.